Crewkerne Aqua Centre is a centre that initially used to be a swimming pool with a teaching pool. We've extended last year and we now have a 30-station gymnasium. We have an activity room which we have Pilates, yoga and aerobic sessions like that. And we have 3 health pods which are used for health services like Desmond training for diabetes and mental health. The Town Council own this building. Crewkerne Leisure Management have a 25-year lease on the building itself. The new extension was part funded by a lottery grant for just over £500,000. We anticipate a turnover this year around £400,000 to £450,000. Crewkerne Leisure Management is a limited company. It is also a registered charity, so we do not make profit as such. Any surplus that we do make at the end of the year is ploughed back to ensure the leisure provision for Crewkerne. It is one of the ways that we're able to extend the building. When the building was extended, they basically combined both parts of the lease into one and made it 25 years again. 25 years is very good to plan. We're aiming the centre at everybody in the community really. We have children and we have lessons right up from when they have their second injection to people in the 90s, both in the gym and in the swimming pool. From people that exercise every day and come in swimming every day to people that come down once a month, once a week just for a leisurely swim, to people that actually take part in Ironman and triathlon competitions. We have 14 paid staff. We also have the equivalent of another member of paid staff in part-timers. We are open for over 100 hours a week, and because of the income model we have, that the expenditure is based on our income, we rely on a very tight staffing structure. We can only really afford staff after we've proven the need for it.
I run at the Aqua Centre a BLT class, and then I follow on by a senior fit class, which is generally about having the people come in, have some fun, do a little bit of exercise, get the heart beating, then we do a bit of upper body toning, then we go down onto the floor and do a bit of Pilates style movement. I also do Pilates here, I also do circuits here, do cover classes as well, and I also do a senior fit class, Aqua Move, on a Friday morning, and a pre and postnatal class following on with the babies on the side of the pool, who normally scream and get a cuddle at the same time. So that's great fun and very stressful.
We do apply for various grants from various bodies, awards for all. They are designed to be for specialist uses. Some people on income support, for example, or tax credits, might not be able to afford some of the services. If we apply for a grant from Awards for All, we can then offer the service at a reduced rate so that it becomes more affordable for everybody.
My emphasis on exercise is not going in, slogging yourself out and then drawing yourself and scraping yourself off the floor. It's about having a bit of fun, having a bit of a social and getting exercise at the same time. 5.
All right, now you're all stars. I'm about to set out on one of our local health walks. We walk for about an hour and a quarter. It's an approximate 2-mile walk, but it does vary and it will depend on the weather. If it suddenly rains, we might have to curtail it a bit. The PCT coordinator that used to be at the Crewkerne Aqua Centre made general inquiries about someone perhaps helping out by doing some health walks. One of the members of staff knew I did a lot of walking and asked if I would get involved.
Well, I think it's a social gathering, something you look forward to, and an opportunity of meeting people and talking about all kinds of things while you're walking, and also enjoying the beautiful scenery around Crewkerne.
It's so beneficial for every sort of exercise need that people have. So it's good for stamina, it's good for anybody who's perhaps had an injury and is recovering. It's good cardiovascular exercise, and people enjoy the sociability of going on these walks as well. But anyway, we started off doing a 20-minute walk around the industrial estate, keeping it all on the flat, but we're spreading our wings now.
We have a very good relationship with the Primary Care Trust. One of the reasons we got the money from Sport England and we did this extension was we wanted to encourage a link between health and activity.
This is a cardiac rehab group, so they're all patients that have either had heart attacks, heart surgery, they've been to the hospital to be rehabilitated, and this is what we call phase 4, where they're rehabilitated in the community. I do cardiac rehab at Yeovil Hospital, and someone from here actually contacted the rehab department at the hospital, and I volunteered my services.
I had an operation last June, and now it's February. And I think I'm fitter than I've been for years.
They're doing cardiovascular exercise. They're programmed to start off with doing 3 minutes on all the CV equipment. We start off with a warm-up and stretches to just prepare the body for the exercise. Then they're doing, like I say, 3 minutes on each piece of cardiovascular equipment.
I went to Yeovil Hospital for rehabilitation, and then that sort of eventually sent us on here. We were doing this at Yeovil until this came into being, so now we can do it on our doorstep, which is much nicer.
I'm my husband's carer, and I can join with him, which means we can do things together, hopefully keeping him fit, because we're both in our 80s now, and we're just trying to keep fit.
We're looking along the lines of Sport England, that we're trying to get people to exercise for 30 minutes or more 5 times a week. So the more activities we can offer, the more likely people are to do it and not get bored with exercising.
We have 2 different projects going at the moment. One is a computerised therapy programme called CCBT, which is basically an 8-week programme for people suffering from depression and anxiety to work on their individual problems. It is a less intense input than actual therapy, but it has proven to be very effective and has received recommendation by various institutions. We also are hoping to run a group on self-esteem and assertiveness and doing some other outreach projects. To be in a place like the Aqua Centre is important because it's easily accessible for people. It's in the community where people are. People feel it's a very friendly venue, feel that it's something they wouldn't feel awkward about going to. It's a much less stigmatised venue than other places where we used to work at.
The close links with the Primary Care Trust came about when, in talks with Sport England, we were looking at funding for the centre. And one of the things that Sport England are very keen on is innovative ways to combine health and sport and activity. So with that, we started talks with our local Primary Care Trust, really by just sort of going and getting phone numbers and names and spending a lot of time like looking around and who's the appropriate person to talk to and how high up is the appropriate person. And after that is actually then finding time to talk to them and actually talk to them and explain to them the benefits of working in partnership, the benefits for them especially, and also the benefits for the community. It takes great courage, I think, for someone to start off doing exercise that hasn't done exercise for a year or so. It's getting people to take that first step, even if they just do something once a week. Once they start doing that for a few weeks, they start to feel better, and then just build it up slowly. Just start off really slowly. And I think the challenge is to let people know this, and that's, I think, the challenge for every leisure provider.
Yes, it's helped. Yeah. Once you get going.